And I'm very happy today in the morning to open a side event, which is devoted to the health as the cornerstone of future of drug policy. And I'm happy to say that Lithuania has a historical reputation of being a small but brave country that leads the way some liberation movements. And I'm very happy that today we are among those who are leading the way to the global movement to make health the cornerstone of the drug policy. More and more physicians all over the world are joining an opinion that punishment of drug users and harsh law enforcement of drug laws do not promote the health and welfare, which is the ultimate goals of the drug control policies. It is possible to protect public health through skillful, targeted regulation of important drugs. And Lithuania believes that all of us should have access to affordable medicine for relief of severe pain and to treat drug dependency. In your case, we are very happy that by organizing this event, this is also the opportunity for you, for doctors, to lead the way and to show the CMD member states how to make health the cornerstone of future drug policy. And so therefore, Lithuania is proud to support this effort towards the global care of justice. Thank you.
Thank you very much. First of all, I'd like to say how proud we are to be here and to have the support of Lithuania, without whom it's would not have been possible. I'd like to just start off by saying that collaboration between doctors working in palliative care and doctors working in harm reduction is something that seems obvious, really, but it hasn't really happened. But after all, finally, doctors are here to relieve suffering, and doctors on both sides do exactly that. I just want to quickly say a piece of business that Lithuania has kindly provided tea, coffee, and pastries, which will be available after the event. I think what I'd like to do is have each speaker speak for about 15 minutes, and then maybe one or two questions to that speaker, and then at the end, reserve about 8 or 9 minutes for questions and answers to the panel generally. So, without further ado, I'd like to introduce Dr. Juan T. Hai Quat from Vietnam, who is a medical doctor and the founder and executive director of the Center for Supporting Community Development Initiatives. This is a Vietnamese non-government organization whose mission is to improve the life of vulnerable populations through community empowerment and the creation of an enabling environment. SEDI serves sex workers, drug users, people living with HIV, their spouses and children, as well as men who have sex with men and transgender people. Dr. Owen has advocated for harm reduction and other effective rights-based treatment of drug users in Vietnam since 2003. During this time, Vietnam has legalized harm reduction programs and moved from mandatory rehabilitation to a more voluntary treatment system for drug users. Dr. Owen is the chair of the Vietnam Civil Society Partnership Platform on AIDS and chair of Council of Representatives of the Asia Pacific Coalition of AIDS Service Organizations. In 2009, the World Economic Forum designated her as a young global leader in recognition of her professional accomplishments and her contribution to important global issues.
Thank you so much, James. Good morning, everyone. It's my pleasure to be here with you, and thank you very much for coming in the early morning for this session. I am going to go through very, very quickly about some of the key issues on harm reduction, and then share with you some of my personal experience. So there's a different definition of harm reduction, but we can say that harm reduction's ultimate goal is to keep people safe, healthy, and out of prison. So there's a wide range of services that can be referred to harm reduction, including needle and syringe program, substitution treatment therapy, but also policy reform and drug treatment and overdose response, community development, etc. So why harm reduction? We all know that drug use can bring about serious health consequences. According to the World Drug Report, there's 1.2 injecting drug users in the world that have HIV in 2011, and 60% of injecting drug users have hepatitis C. The World Drug Report also called that there's 211,000 drug-related deaths in 2011. And we, as a doctor, believe that this number is underestimated. And sadly, most of these deaths are preventable. So the other reason is that we all know that drug dependence is a complex chronic condition and without a quick fix. It is not the failure of the person. It is a complete mix of many factors, including biological factor and environmental factor, including the gene what people was born with, including the family where they grow up, the community where they grow up, including the fact that the drugs available around them and sometimes it's cheap, including the brain mechanism in interacting with drugs and the environment, etc. And as a doctor, we know that it's a health condition and it is not easy to treat dependence, drug dependence. And we also know that harm reduction is effective in protecting health and also not lead to increase of drug use. If you look at the World Drug Report of 2013, you will see that as the number of the country support harm reduction increase, we reduce the number of injecting drug users that have HIV. But at the same time, the number of injecting drug users globally also decreased, despite the fact that opioids become more available. It's increased more than 4 times between 1980 to 2010. Yes, the number of injecting drug users decreased when harm reductions increase. I just want to share with you this number from my country, Vietnam. As you could see, when we start to work on harm reduction, so HIV prevalence among injecting drug users start to decrease. And when we legalized harm reduction in 2006, the number continuously decreased. So we had reduced the HIV prevalence among injecting drug users from almost 40% to around, as I speak, around 13%, 14%. So 1/3 we are now in comparison to more than 10 years ago, before we had harm reduction. And together with that, the total number of people living with HIV in my country is also decreased significantly. You can see the peak of the number was when we started harm reduction, 2006. And it took only 1 year for the number of people living with HIV start to decrease. And we continuously decrease ever since. But why we are still here talking about harm reduction if harm reduction still are so effective? We still have many more deaths due to drugs than war. I come from a military family. Both my father and my big brother are generals in the army, so we know wars. My father started to enter the wars, Indochina #1 war with the French, back in the 40s, and he fought all the wars ever since. If you look at the number again, drug-related death in 1 year, 2011,000. And the Foreign Policy Journal estimated that in the 21st century, every year, the number of deaths globally due to war is 55,000. The number of deaths due to drugs, 200,000. So it's 4 times more than wars. And from the country where I was born and raised, for the 9 years of the First Indochina War, combined French and the Indochina people, Vietnamese, Laos, and Cambodian, we lost probably like 250,000 people in 9 years of war. And during the 20 years of Vietnam War, you probably all know about that. The US lost 58,000 lives. The Vietnamese lost between, depends on different way of estimate, 800,000 and 3 million in 20 years. So in average, every year, we still lost less people than drugs nowadays in the 21st century. This is so unacceptable. This is so unacceptable. And like war, we don't want war. There's so many demonstrations and nobody wants to go to war. No country wants to be involved in war. And we all believe that war is preventable. So as the drug-related death, most of them, vast majority of them can be prevented only if we have a right policy. There's so many deaths because there's still not many countries go to the full land for harm reduction. So among the 158 countries with injecting drug users, there's only, by 2012, there's only 97 countries with some policy support of harm reduction. And the policy doesn't always go with the program. Only 86 countries with some needle and syringe program. Why I say some? Because in some countries, if you take all the needle and syringe divided by the number of drug users, in some countries there's only 0.1 syringe per injecting drug user per year. It is so far from what is recommended, is 200 syringe and needle per year per drug user. And also, the number of the country with substitution therapy even less, only 77 countries. And the coverage in these countries, in some of the countries are also very low, like 1%, when what we need is 60%. So national policy, sadly, still the main obstacle. And so there's no policy support, but also there's serious lack of funding for harm reduction. This is the number I just want you to pay attention to. Australia is considered as one of the very, very progressive country on harm reduction. Yes, the budget for law enforcement is 33 times more than for harm reduction. But they're still not so bad in comparison to the US or to many other countries. Just look at the statistic. Me as a person, I was trained in a medical school in one of the best medical schools in the country. My parents was very proud. And I worked in a hospital and I worked in medical school. But I had made the decision to leave medical practice to work in policy advocacy. It was such a difficult decision. My family was so disappointed. And even me, I still, until today, sometimes I feel the feeling of tingling on my fingertip. Because I work in outpatient clinic and every day I touch so many patients. And now I'm not touching patients anymore, I'm not doing examination anymore, and the sensation is still here. There's that craving. And as I speak now, I feel like shivering because I miss the patient. Anyhow, I made that decision because of my of what I see. And also because I'm a mother. Here are my boys. I have 2 sons. Sometimes I was terrified by the thought that one of my sons might one day use illicit drug. And my fear is not because of the fact that he used drug. We all know that not everyone who uses drug become dependent. We know that even drug dependent is difficult to treat. There's no cure as such, but it's treatable. But my fear is that his drug use would make him a target of the legal system. In many countries, all kinds of drugs are made illegal. Even cannabis, even ecstasy. If you go to the club and you want to have the best of fun, that could lead him to be arrested. And be in court in many countries, even for the first time of any illicit drug, would subject him to sanction. It could be prison. He could be put in prison, but he could be put in the compulsory treatment for a very lengthy time. Could be like 2 years or more, just because he smoked the cannabis or because he go to club and use some drug to have fun. And he will be labeled as a drug user for the rest of his life. He'd be stigmatized, he'd be watched by the local police just because he used drug. So, and if he's being caught using with friends, that would make one or more of them a criminal for organizing drug use. And if he is caught with a dose of drug, that would make him a criminal for storing drug. I'm sure that many of you here have children as well. Let's think about that for the children. And I'm a doctor, but my medical profession would not even be helpful to my son, to my own son, if this happened to him. He may get HIV or hepatitis because he had to hide his behavior because nobody tells him about the danger. He may develop mental health problems with all the pressure he has to go through. He may have an overdose and not be rescued because it's still illegal in many countries for a non-medical person to inject a life-saving medicine for a person with overdose. His life may be totally ruined just because he used one dose of drug. So I trade medical practice for policy advocacy because as a doctors, we try our best to save lives. And as a doctor, we can only save life one by one. But a bad policy can kill massive, while a good policy